Thank you very much, Mr. President. Mr. President, I come to the floor today, as I have so many times since the President's health care bill was signed into law, with a doctor's second opinion. And I do that because I practiced medicine in Wyoming, taking care of families from around the state for about a quarter of a century. And when I talk to patients at home, when I talk to people on the street, when I talk to folks all around my state and around the country, what I hear is what they wanted from a health care law was an opportunity to have care they need from the doctor that they want at a cost they can afford. But what we've gotten in this country through this administration and this health care law is a law that is bad for patients, in my opinion, bad for providers, the nurses and the doctors who take care of those patients, and terrible for American taxpayers. So I come to the floor again with a second opinion today, Mr. President, because I'm thinking about job creation, and we just heard about the Keystone XL pipeline and the opportunity there with the shovel-ready project to get people back to work. And I'm reminded of what former Speaker of the House Nancy Pelosi claimed after the health care law was passed, and she said that it would create 4 million jobs. She went on to say 400,000 jobs almost immediately. Well, as we all know, Mr. President, that prediction never came true. In fact, the nonpartisan Congressional Budget Office said that the health care law will actually encourage some people to work fewer hours or to withdraw from the labor market altogether. Well, and just this past week when the employment statistics came out, we saw that over 300,000 Americans have withdrawn from the labor market altogether. It is interesting that at about the same time that the health care law was signed, March 2010, Senator Chuck Schumer, New York senator, claimed on Meet the Press that he said, as people learn about the bill, and now that the bill is enacted, he said it's going to become more and more popular. Well, in fact, Mr. President, this health care law is less popular now today, December 2011, than it was at the time it was signed into law. So we look at all of these predictions that never came true. It's been 20 months. The health care law's popularity remains low. The law is in front of the Supreme Court to deal with the constitutionality of this government going into the homes of American people, telling them they must buy a product. It is clear that Washington Democrats and the President have miscalculated. They made promise after promise to the American people. They asked families, they asked businesses all across the nation to trust them. The President promised that if you like what you have, you can keep it. The American people know that that promise has been broken. The President said that premiums, health care premiums for insurance costs for families would drop by $2,500 per family per year. We now know that the costs have gone up higher than if the law had never been passed in the first place. Week after week, we hear of more unintended consequences within the law, glitches that are found which show additional problems with the law, and additional President's promises being broken. The American people know that they do not like this health care law, and when you ask them, do you think this health care law was passed for you or for someone else, most Americans will tell you that they think it was passed for someone else. So today I want to talk about two specific examples of problems with this health care law and the possible unintended consequences and some of the repercussions of the things that have happened with this health care law. And one has to do with the labor statistics that came out December 2nd of this year. They released updated payroll, employment, and unemployment numbers. And the Bureau of Labor Statistics data actually showed that health care employment was up in November. It was up for all the wrong reasons. The problem is that the health care law's excessive mandates and burdensome regulations are prompting the health care industry to create additional administrative jobs, not caregiver jobs. The health care law was supposed to actually work to get more doctors and more nurses and more x-ray techs and physical therapists to take care of patients. But that's not what happened. Now we see that it's administrative jobs that are up, not caregiver jobs. As a matter of fact, the USA Today printed an article, half-page article, and the title was, "Healthcare Jobs Grow in Administration." The article actually talked about a New Hampshire hospital, and that hospital, according to the article, was forced to eliminate 5% of its workforce. So you have a hospital eliminating 5% of the workforce after the state cut Medicaid funding last year. So here's a hospital, 5% of the workforce is cut. Many of those workers, nurses and other caregivers. Caregivers, I think of physical therapists, radiation technologists, nurses' aides. Yet, in spite of the fact that they've had to eliminate 5% of its workforce, they're actually still hiring. Well, how can that be? Well, let's listen to what the hospital's vice president, Mark Whitney, said. He said, quote, he said, "We need to deal with new technology, new services, new regulations, electronic health records, government reporting requirements on quality. A lot of this," he said, is related to the new federal health law. So they're eliminating nursing positions, eliminating positions of caregivers, and hiring more people to push paper. Well, the president and the Democrats in Congress promised their health care law would expand health insurance coverage. Look at what is happening now. More and more people pushing paper. It's interesting that what the president and Democrats did not tell the American people is that the health care law's oppressive mandates, burdensome regulations, would actually cause health care employers to lay off or stop hiring the very health care professionals needed to treat patients. Instead, the health care employers must be hiring more clerks, more administrators, more paper pushers, all in an effort to figure out and then comply with the health care law's rules and mandates. I do not believe that that is the change most Americans wanted when they started to think about health care reform. The second example I'd like to give, Mr. President, is from a column in the Washington Post, December 2nd of this year, just a week or so ago, written by George Will. And the article is titled, "Choking on Obamacare." The article talks about the health care law's crushing insurance mandates and how those influence both small and large businesses in terms of their willingness to actually hire new workers. Because when you have this kind of record unemployment like we're dealing with in this country, you want to have businesses hire more people, get people back to work. That's what makes America grow. That's what helps our economy, putting people back to work. In the article, they use the example of the restaurants, Carl's Jr.'s, Hardee's restaurants. There are about 3,200 of those restaurants around the country, and the company, the parent company, says that they have created about 70,000 jobs, and they want to hire more workers. But the CEO of the company, Andy Pudsner, says that they can't hire more workers because they don't really know how much they will need to spend on health care. They're planning to spend about $18 million on health care, and they say that's just a guess. They're trying to, if you're running a business, you want to be able to figure out what your future costs are going to be, what the expenses are going to be, and you'd rather have a little more predictability than just guessing. But thanks to the health care law's complex formulas and many regulations which have not yet been released, and many of the uncertainties that continue to exist, this is a company that's going to have to guess about how much they'll need to spend on health care. Well, what business can afford to guess what one of their largest costs is going to be? Well, they're guessing they're going to have to spend about twice the amount of money on health care as they did building new restaurants last year. So they talk about building new restaurants, and those are construction jobs and then jobs of the people who work in the restaurants providing services, and they're going to end up spending about twice as much on health care as on building new restaurants. Well, it doesn't take a lot to realize that hindering a company's ability to build new restaurants means fewer available jobs, construction workers, for service suppliers in a struggling economy. The CEO of the company is right when he says that, quote, employers everywhere, he says, will be looking to reduce labor content in their business models as Obamacare makes employees unambiguously more expensive. Well, if we want to spur the economy and economic growth and job creation, Mr. President, Washington must take its shackles off of our job creators. And this is just one more reason why the President's health care law must be repealed and replaced. Thank you, Mr. President. I yield the floor